Having a healthy mouth is all about controlling the oral environment, creating the right conditions for the teeth and gums so that they remain free from harmful bacteria and parasites that can cause tooth decay, gum disease, and a decline in total body health. So, what does it take to maintain a healthy oral environment? Well, you have to clear the mouth of debris like food particles and plaque. You have to clear the mouth of harmful bacteria that can proliferate and cause tooth decay and gum disease. You have to maintain an alkaline environment because harmful bacteria and microbes often thrive in acidic, low-oxygen states. You have to preserve the integrity of the gums to avoid infections like gingivitis and periodontal disease, which lead to receding gums and tooth loss. You have to remove the sticky layer of biofilm that covers the tongue, teeth, and throat with bad bacteria. And, obviously, you have to keep the teeth clean so that they remain free from plaque and other nasties that can erode enamel and cause decay. And how do you achieve all of this? Well, first you'll need the right tools. You'll need floss. You can use a flossette or string. It doesn't really matter what type of floss you use. It's all about technique, which we'll get to soon. Next, you'll need a toothbrush, ideally one with fine and soft bristles. When the bristles are fine and soft, they're gentler on the gums and are better able to penetrate those hard-to-reach places in the mouth. Like flossing, it's important to use the right technique when brushing, but more on that later. Next, you'll need our brushing solution, a toothpaste substitute designed specifically to restore the balance of microbes in the mouth by creating an alkaline environment, killing bacteria and parasites, and helping to heal damaged gums. And finally, you'll need Perio-Mix, a gum and tooth powder formulated from natural ingredients designed to restore and maintain healthy gums. An effective oral hygiene protocol isn't just about using the right tools though. It's about using the right technique and doing things in the proper order. The first step is to floss your teeth. Flossing will dislodge debris and bacteria, especially from those places that the toothbrush can't reach, and most importantly, will break through biofilm. Biofilm is essentially a shield for plaque, kind of like moss on a rock, so breaking through it improves the effectiveness of brushing in step 2. When flossing, using the right technique is very important. Using the wrong technique can cause trauma to the gums. Instead of going in and out as most people do, you want to gently slide the floss between the teeth, giving them a good rub, spending about 5 seconds on each side of the tooth, making sure you've broken the biofilm and dislodged debris. You want to avoid going straight up and down and smashing the floss into your gums. After flossing, it's time to move on to step 2, brushing the teeth and gums. This is to remove plaque from the teeth, which in turn protects enamel and prevents decay. When we think of brushing, we usually concentrate only on the teeth, but it is equally important to get in and around the gum gutters to remove plaque at the base of the teeth. This is to prevent bacterial and parasitic infection of the gums, which can cause gum disease. To brush your teeth and gums, you'll need to use the brushing solution. Unlike regular toothpaste, it is fluoride-free, made from all natural ingredients like hydrogen peroxide, oil of cloves, peppermint, and organic aloe vera, meaning it is healthier for your mouth. Its unique formula is designed to stop the formation of biofilm on the tongue and teeth, remove plaque from the teeth to protect them from decay, create an alkaline environment in the mouth to prevent the proliferation of bad bugs and bacteria, restore the natural balance of microbes that live in the mouth so that health can be maintained, and to promote the healing and ongoing health of your gums. Using the brushing solution is very simple. Although it is a liquid, it is designed to be used almost exactly like a toothpaste. Simply pour 2.5 to 5 ml into a small container and dip your toothbrush into the solution so that the bristles are covered. Then, brush your teeth and gum gutters, cleaning only 2 teeth at a time. When brushing the teeth, a simple back and forth motion works. However, when brushing the gums, you want to use a gentle circular motion and have the brush tilted on a 45-degree angle. This ensures the bristles reach the gum gutters and sweep out the debris. In order to brush your teeth and gums properly, you want to spend about 1 minute on each quadrant of your mouth, starting on one side and working your way to the other. Always ensure your teeth feel clean and smooth before moving on to the next quadrant. If they still have that furry feeling, they need more work. Because we are brushing both the teeth and gums, proper brushing will take longer than the recommended 2 minutes, so don't be alarmed if this process takes more time than usual. That means you're doing it right. Once you've finished brushing, you will need to rinse and gargle. Normally, this would be done with water, but not here. Instead, rinse and gargle with the remainder of the brushing solution. This ensures that any bad bugs and bacteria sitting on the back of the tongue, throat, or tonsils are dealt with. Rinsing and gargling with the brushing solution also amplifies all the benefits of brushing with it, preventing biofilm formation on the tongue, oxygenating the mouth to create a healthy environment, supporting saliva production to protect the teeth from decay, and ultimately providing longer-lasting protection for your mouth. After rinsing and gargling with the brushing solution, spit it out and remember not to rinse with water after. The longer you leave the residue sitting in your mouth, the more effective it will be. You've now finished taking care of your teeth and have cleared the mouth of bacteria and debris. But there's one final step that remains, and that is to take care of your gums. For this step, you'll need to use PerioMix, which is a powder formulated from all natural ingredients like bicarb soda, pure salt, sodium ascorbate, and fresh peppermint oil. Its unique combination of ingredients is designed specifically to promote gum health. Bicarb soda and salt are both antibacterial and are designed to reduce bacteria growth in and around the gums. Salt is also a tightening agent, pulling fluid out of the gums so that they can tighten around the base of the tooth, ultimately ensuring the gum gutters are smaller and more easily cleaned. Sodium ascorbate, otherwise known as vitamin C, is included to promote collagen production, which helps to build gum tissue and aid healing and repair. Bicarb soda is alkaline and works to create an environment in which bad bacteria struggles to grow. It also neutralises plaque acids, which protect the enamel and can even aid in the remineralisation of enamel. Using PerioMix is easy. Simply place 1 to 2 teaspoons of powder in the palm of your non-dominant hand. Then, lick the index or middle finger on your free hand and dip it into the PerioMix. Take the PerioMix and pack the powder generously around the gum lines and in between the teeth, making sure you are filling the gum gutters. Start on the upper teeth to prevent excess saliva pooling in your mouth, and always make sure you're packing the PerioMix on both the outside and inside of your teeth. Once you've finished packing the PerioMix into your gums, spit out the excess, but don't rinse your mouth with water. You want to leave the residue in your mouth for as long as possible so that it can work properly and create a healthy oral environment. The PerioMix will dissolve in about 1 to 2 minutes, at which time you can swallow and go about your day as normal. Just make sure you don't drink for at least 1 hour. And there you have it. You now know how to clean your mouth properly and maintain oral health. First, floss. Then brush your teeth and gums using the brushing solution. Then rinse and gargle with it. And finally, pack PerioMix in between your teeth and gums. You'll need to complete this process twice per day, once in the morning after breakfast, remembering not to eat or drink for at least 1 hour after completing the process. And then, once again in the evening after dinner, remembering never to eat after this and to leave at least 1 hour before drinking water. Do this twice a day, every day.